persons at the table and in the audience. Ladies and gentlemen, good evening. I represent the health department and specifically the primary health care section. And for primary health care, we're talking about prevention. So we try to prevent illness before they happen. When they happen, you go to the hospital and then they spend a lot of money trying to get to rehabilitate or cure it. So we are trying to prevent it. And this evening I want to talk to you about 4 specific areas under our portfolio. And there are not a number of others, but I just want to pick out 4 areas that I want to share with you. And the first area I want to talk to you about is our vector control program that we have been doing in the parish. For the last 2 years, we have been under what we call a dengue outbreak. This has not yet been lifted, even though the notifications have been coming down, and the ministry is currently in the process of evaluating the program to see if the minister can have it declared over. But as this continues, just to share with you for the month of February, the ADT index for Westmorland is at 7.7%. The World Health Organization says that at ADT level of 5 or less means that transmission of disease is lessened. So we are still not at 5%, but we're working to get the parish down. And that will require support of all stakeholders within the parish, and that's our residents. So for us, we practice what we call the 4 S's. And the first one is to protect yourself, self-protection. So you going up at night, you wear your repellents, wear long sleeve clothes, so that you can prevent yourself from getting bitten by the mosquitoes. The second S is search and destroy once per week in and around your homes and your workplace. The life cycle of the mosquito takes about 8 to 10 days, depending on the temperature of the body at the time. So if we can disrupt that cycle within 7 days or a week, we can prevent breeding in and around our premises. A lot of time we get complaints from residents of mosquitoes, and we do more investigations. They are the ones that are actually breeding mosquitoes right on the premises, because the mosquito doesn't fly very far from where they hatch. So we have to be continuing on reminding persons to search and destroy, once per week in and around the premises. Anything that can hold water, mosquitoes can breed in it. The third S is to seek medical attention if you feel ill. Don't do it around treating it with homemade remedies and so on, because sometimes that can lead to worse outcomes. So as soon as you get ill, if you have any flu-like symptoms, visit your health professional, whether private or hospital or public, and get medical attention. And then the fourth S is to support our vector control workers in and around the parish. They come during the day and they come during the evenings. Alright, during the day they are doing checks to see if there is breeding on their premises, and if they do find them, they will treat them to try to prevent any outbreak situation. And in the evening you will see them coming through doing fogging. We have at least days here for schooling our workers, feed them sometimes, injure them. And so we are asking for you to support us as we work together to try to keep our parish safe and free from disease. The second program I want to talk about is our water truck certification program. Currently, last year we had a very severe drought, and we saw a lot of water being trucked towards establishments as well as residents. And we, under the Public Health Food and Regulation, initiated what we call a water truck certification, meaning that we had a program where our water trucks that provide water, we had them certified under the Public Health Food and Regulation. Under that regulation, water is also food. that opportunity to certify our trucks. Currently, we have about 65 trucks in the parish that have been certified. And at this time, March to April, we will be doing a recertification of those trucks. What it means that the trucks, when the drivers went through a training under the food handlers permit, and we gave the food handlers permits, then the trucks were sanitized, and they went through the national public health lab coming down and assisting us, and we did a certificate sanitization of trucks, the inspection and then ensure that they met public health standards, and then we gave them a certificate, like the food handling certificate, as well as we also had a decal, look like something like the license that we put on the cars, and they have that on the trucks as well. So here's also a QR code on that license that you can scan it, or you can go print and scan it, and we'll show you the names of all the trucks that have been certified in the park. So we ask you to reach out to the different agencies, you can reach out to the department, you can reach out to the municipal corporation, and get that list of certified trucks that we have in parish, so that if you require any bulk water supply, you can have those certified trucks taking clean water to you, or potable water to you. Right? We have had so many incidents of persons who was going to any rivers, any stream, and just picking up water and taking to residents. And we have had in the past, we have had outbreaks at schools and other institutions because of that. So we are trying to ensure that we provide safe water to our residents in parish. The third program I want to talk about food safety. Under the public health food handling regulation of 1998, all food handlers and whether owners, operators or workers must possess a valid food handler's permit. We have been struggling with this for a while, and I can tell you that the department, we're going to be taking a no-nonsense approach this year, 2025. In fact, I can tell you we have actually had several persons before the court, they included, because they did not have their food handler's permit. And so we'll be coming around. We started in December, and we'll be visiting all food handling establishments and ensure that they have their health certificates. These health certificates are to be displayed as well. So if it's not displayed, you can also be prosecuted. We're going to be taking a zero approach, and all food handling establishments and workers must have their food handler's permit. Finally, I want to talk to you about waste disposal. I'm not talking about solid waste, I'm talking about liquid waste or sewage. The CEO spoke about our planning department, and we're building plans come to the parish council or to the municipal corporation for approval. When those building plans are sent to the municipal corporation, a copy is sent to the department, where we assess what type of sewage disposal system is going to be used, whether it's a commercial or a residential property. And then we recommendation to the parish council of the municipal corporation. The agency will tell you that 100% of the water supplies in Westmorland comes from underground. 100%. It means that if we continue to dispose of our water, our wastewater in this parish, using straight absorption pits, as we've been seeing a lot of residents do, very soon we'll have to get our water from St. James or Trinidad, because we're going to be contaminating our underground water supply very soon. So in this parish, the health department does not recommend any development that has absorption Any waste disposal system must first have a septic tank or an real bed or a tile field before we will recommend it. We're not recommending any absorption with anywhere in the parish. Westmorland has a very what we call a very high water table. And once you dig up for a few feet, you're going to be into the water table. So if you put in absorption bits, you're going to be contaminating or one of our water supply. Right. NWC will tell you that in Morrisville Road, Houston, there are several wells right here at the head office, which cannot be used for domestic water because they have been contaminated by the underground aquifer have been contaminated by absorption in and around that area. And so they cannot be used for drinking purposes, for domestic purposes. So I'm just gonna ask our residents that when you submit a million plan, but our recommendation is made to you for waste disposal, we try to stick with that. Many times we have visited and seen that because we're given permission to put in septic tank absorption pits. And we visit them, and they finish construction, all they have is an absorption pit on the top. We cannot continue to contaminate our underground water supply, and so we must abide by the recommendations from the corporation. And those are the four I want to talk to you about, so I